I wonder if you could
guide.
Oh, I'll get that.
Awkward guide. Sorry.
I wonder if you can comment on outcomes in terms of sexual response in people who've completed reassignment surgery.
So you're talking about orgasm?
Yeah.
Okay, so they're poor. Yeah, the surgical procedures to date, neither one of us are surgeons. We have not in any way adopted or know a lot about the techniques, but we do know from we hear about from our patients and our colleagues that their surgery's got to come a long way. They are attempting to move some positions around a little bit. There are some very specific phallic and techniques as well where they can actually unfold the vagina out and do some techniques with that, as well as folding the penis in. So there are some techniques as well. I'm not a surgeon. I couldn't speak with any sort of expertise, but I do know that that sensation is something that many people regret that they lose a lot of. And so Dr. Wicklow, I think, knows a bit more about this than me.
I'm doing that surgery.
Oh, you are? Okay, good.
No, come on. Men, it's, or female to males, it's really quite terrible. So they call them Franken penises. They don't function very well and they don't feel very well, which is why a lot of people, even the DeVries studies, those people who went for gender reassignment surgery, those are basically male to females or males that have had mastectomies, but they haven't gone for penile reconstruction. But male to females, we know a little bit about from the disorders of sexual development. So those girls with CAH that I was talking with that are born that look like male bottoms, so they have clitoromegaly, and their clitorises can be anywhere around 2 centimeters, which would be a newborn boy's phallus. Urologists have now been able to take the nerve endings from the top of that clitoris, take away all the tissue, tuck it back in, make a hood, and they actually have very normal sensation that remains from that. So girls tend to do a lot better, I think, than female to males do.
Thank you.
Fascinating and enlightening. In the course of my practice, I've had 3 transgender patients who I've been performing psychotherapy with. And I went to my deity to get some support and knowledge, and that was Glenn Gadward's textbook of psychiatric treatments. And I forget who wrote the chapter on gender dysphoria, but clearly very strongly felt that prepubertal kids should be treated with a view of getting them back to being their birth sex and birth orientation. You described it as unethical, so this book is less than 4 years old. So I'm wondering, is there another school of thought out there, or has there been a real radical shift in thinking since I bought that book?
Yeah, there's been a radical shift in thinking for most people doing this kind of work. I think typically, I think now we're looking for cautious support, and we're certainly not pushing a family or individual in either direction. We're really trying to support where they are, what their goals are, and those goals have changed. We have many individuals where they change their mind, where we've supported them for a few years, and they say, you know what, actually, transgender is not really what we were looking for, but thank you very much, and this has been helpful, and they go on to whatever life they were going to lead otherwise. But the reparative therapy, the data is awful. There's a lot of really bad outcomes as a result of it. This is part of, there was a bit of a backlash against Dr. Ken Zucker in Toronto, who is actually one of the stronger proponents of some of the reparative therapy. What we found and what the guidelines have shown and what the data has shown is in fact that pushing a child back to their biological sex, if they're experiencing distress around this or impairment around this, is often not the way to go, and it creates a crescendo of other internalizing disorders like anxiety, depression, and suicidal attempts. And so it has changed a lot. And so I think there are supportive therapies you can remain neutral, I think, but the therapies that are actively trying to push kids back, a rejection of their own internal sense of gender identity tend to do damage.
Thank you. Where's my candy?
Oh, I'm sorry. Sorry, I gotta have a better throw on here.
Thank you for this very excellent presentation. I have a comment and a broad comment and a narrow question. The broad comment is historical, that 30 years ago when we were seeing adults with gender dysphoria, we were not seeing people who had an onset of gender dysphoria in adult life. We were seeing people who had lived for 20 and 30, and on one occasion over 70 years with gender dysphoria and doing nothing much about it. And the outcomes were lousy. with or without hormonal treatment, with or without surgical reassignment, in part because so much water had gone under the bridge. So I think the shift professionally to looking at this as a as a manifestation in childhood and adolescence, rather than starting after the age of 18, is a very, very important thing for the individuals and for the families involved. So I think that's really, really important. The question, which is narrow, has to do with something you ran by quickly, which is schizophrenia, because we do see people with psychotic disorders who present with gender identity questions or issues or gender dysphoria. And I had a debate with a colleague from Vancouver at one point about whether that ought to or ought not to be, in a sense, an automatic contraindication. So I wonder about your thoughts about that.
The question is, first of all, user Candy, Michael, sorry if I hit you. My throat's getting better. Yeah, I've hit people in the head 3 times. It's really not the quarterback's fault at that point. So I think your question would be, is having schizophrenia an absolute contraindication of a diagnosis of gender dysphoria?
No, not of diagnosis. I mean, diagnosis is a movable feast, but of specifically interventions, hormonal and surgical interventions.
Sorry, can you say that question one more time? Just want to make sure I understand.
Somebody's got schizophrenia, and they say, I want to be, I am a woman.
Okay.
Although they're a biological male, a natal male. You touch it or you don't touch it.
Yeah, well, fair enough. And I think that would be something you need to start establishing a relationship with. You start understanding, is this something that heightens or lessens with psychotic or thought disordered episodes? And I think if you could separate it out from the psychotic thought disorder itself, this was a unique, independent part of the person, I think you would be sort of behooved to treat both. To not only treat the psychotic presentation, but at the same simultaneously to address issues around gender identity. And also pay attention if treating the psychosis increases or lessens gender dysphoria. I think we have to sort of start understanding what the relationship is between those 2 things. But the literature would say to treat both simultaneously, and while it's rare, we still have seen this. And I have one individual at least with psychotic disorder along with GD that unfortunately has been in hospital a couple times, and the hormonal therapies keep creating symptoms and actually keep on destabilizing aspects of his auditory hallucinations. And so we're kind of working on trying to stabilize schizophrenia before we go into aggressively into hormonal treatments. And that's sort of one of the binds we get into, treatment binds. But we're attempting to treat both, and that would be my answer.
Thank you.
Welcome.
Let's check at St. Boniface. Is there a question there? Yes, go ahead.
Hi. I'm just wondering, of the people who actually go through the gender reassignment surgery, how much of them or how many of them actually report being content with the procedure afterwards? And because you mentioned a Franken-penis, and that, from my standpoint, would be something that people might not be too
But it's
content with.
huge.
So,
Yeah, the Franken-penis is apparently huge, so they're pretty happy. I'm kidding. You're right. I mean, obviously, with an outcome like that, those people are not going to be very happy. But overall, most people that are going through transition in general, being supported, are happy with the hormonal aspects, are happy with the family and psychological support. And a vast majority of people are happy with gender or sex reassignment surgery, but there certainly are negative outcomes. If you need a take-home message, though, a majority of people are satisfied with the outcome and feel their life is better as a result of it.
It's better than their natal. It's better than their natal genitalia. Something better.
Can you comment? Can you tell them talk? Like we've had youth come in and so excited and proud. And
Oh yeah, sure. Anecdote. Yeah. Repeat the question now.
Yeah.
Okay. The question was, are people happy and satisfied with the outcomes after sex or gender reassignment surgery? And the answer is, for a vast majority of people, the answer is yes. There are bad outcomes, and those bad outcomes are often due to Unfortunately, in the last 5 or 10 years, surgical procedures have advanced quite a lot. But going back 5 or 10 years ago and any time before that, there have been nightmares. There have been franken-penis nightmares and other situations like that that have created bad outcomes for some people. But as I said, overall, a vast majority of people are happy with the sex or gender reassignment surgery, and that's one of the reasons why we do this kind of clinic, because we know that outcome. Thank you for the question. Hey, what's up?
Hi, my name is Sean. I'm Med 3, so
Hey.
Wow!
So I apologize